is the cleft nose and lip patient which I am operating. I was doing the marking. Now I'm opening the nose and releasing it from all the bony structures. So in this particular video, I have finished the lip and nose correction. So you can see the straight dorsal aesthetic line. The tip has been more defined. The ala asymmetry that were little up and down has been corrected, and the tip is better projected and more defined than what it was before. And you can see it from all the angles that the nose is looking perfect for her face. The main problem with cleft nose and lip patient is they do not want to live with the stigmata of a birth deformity, and they want this to be corrected to as normal as it can be. Though birth deformity can be corrected, but it can never beat the creation of God and be 100% normal. It can be near normal, but one should not expect it to be 100% equal to the normal noses. You can see it looks nice, and over a period of 4 to 5 months, the swelling of the lips will decrease and she'll get a better shape of the cupid bow and the lip line.
For more information, call on these numbers. Our managers would be happy to assist you. And if you want to know about the prices, please visit our website, our Insta page, and check the results of our patients.